Project, sorry, working in Project Oris at the intersection of AI and dental health. So, Katherine, the floor is yours. Feel free to introduce yourself. Would love to know about you as well as the initiative you've taken.
Thank you so much for having me. I'm excited to contribute to the productive conversations today. My name is Katherine. I graduated from Virginia Tech last year. And for the past 8 months, I have been working on my startup with my co-founder, which is committed to revolutionizing the US nicotine harm reduction market with a patented zero waste product that basically eliminates combustion, inhalation, toxic waste, which are all very important factors, as it is designed to combat the environmental and public health crisis caused by cigarettes and disposable vaping devices.
That is so great to hear. We will learn more about the initiative that you've taken at Zolv, and the progress you've made thus far in it with it as well. But Rita, feel free to introduce yourself and would love to know about Project Oris a little bit.
Yeah, can everyone hear me? Okay, sounds good. Hi, my name is Rida. I am a senior at Penn State University studying biobehavioral health with minors in biology and global health. 2 years ago, my team and I competed in our university's AI competition where we developed our project Oris. Oris is an AI-based mobile application that allows users to perform dental imaging through the use of a mobile phone and an attachable device that we created. And with machine learning, our app identifies early signs of dental caries and gum disease.
Super, super cool. Both of these are actually extremely incredible projects in the global health space, kind of tackling a lot of the issues that the youth space specifically faces, and particularly Katherine, your project, which, to be honest with you, an epidemic that we've noticed in the recent years with the age group that ourselves kind of fall into, as well as some kind of unfortunately beneath or above us as well go through it. So I would love to know kind of how you got started in this journey and what got you into developing this passion for helping those facing nicotine addiction and kind of going about it in the safest way possible.
Yeah, of course. So, I mean, as you said, the vaping epidemic kind of had a chokehold and still has a chokehold on Gen Z. So, the concept of Zolv was really just created after the realization that my peers are struggling to quit vaping or smoking too, and not because they lacked willpower necessarily, but because there was no solution designed for them. And their unique addiction profiles. So my co-founder and I started researching harm reduction alternatives and brainstorming solutions for this. And what was kind of crazy was within 30 minutes, we had like a list of 10 new product concepts. And that realization really hit us hard because we thought, how could a problem this massive have so little innovation when we literally just came up with 10 new concepts for a product? So then we realized that it was because the US regulatory landscape is fundamentally broken, making it the regulatory barrier so intense and costly so that nobody really is willing to take the burden of bringing a new product to the market. So we made the decision to bring what we thought could be a revolutionary product to the US ourselves, no matter how I guess challenging the journey will be, because the nicotine industry is one that desperately needs change, and we really haven't seen anyone else stepping up to make it happen. So that being said, our mission is to moreover just kind of start a movement, not just sell a product. The product will serve as a catalyst in assembly of that movement, but our goal really is to empower our generation, the 21 plus category, especially those caught in the disposable vape cycle, to break free from what is no longer serving them. And as young adults increasingly represent a significant share of the newer nicotine users, it's critical that our voices shape the industry's future.
I really appreciate you bringing in the idea of youth voice and advocacy in here as well. But before we move to Rida and how you got started in Project Oris, I'd love to introduce Oyinkansola, our other panelist who just joined. How are you?
Hi, Rakib. I'm good. And you? Thank you
Yeah,
for inviting me.
doing great. Thank you for being here. I'd love for you to kind of introduce yourself, situate yourself in the panel, and we can get started.
Okay. Hello, everyone. It's a pleasure to be here. My name is Oyinkansola Babyode. For short, Oyin, I'm a physician and second-year global and environmental health master's student at New York University. I also co-chair the UNA USA Environmental and Climate Action Affinity Group.
Perfect. Glad to have you and your expertise in the medical field as you are studying for your degree at NYU. And I'd love to know a little more about some of the projects regarding global health specifically and at the intersection of the climate crisis sector. Yeah, what got your passion started there at the intersection of climate and global health, and how do you think each other one play into the other?
Okay, thank you for that question. So I actually didn't start out by having my research interest in climate and environmental health. I actually started off as a women's health advocate, of which I still am. And coming to do my master's degree in global and environmental health really exposed me to seeing how women's health and also climate change are very intersected, as well as environmental health. Coming from the global south, I have experience with treating women and knowing that indoor air pollution is something that a lot of women in the global south are disproportionately affected by because of unclean cooking methods. And so this has been my focus in research and environmental health and climate action.
Very cool. The interdisciplinary panel that we have here is actually amazing. We have youth voice, including youth advocacy in the global health space, as well as bringing in the idea of the climate crisis that plays into the global health space and worsening conditions as well. Let's shift gears a little bit and get into the technical side of things here with Rida. I would love to know kind of how you got started with Project Oris, what it kind of is, how it works, a little bit more in depth into the project itself.
Yeah, of course. So it's really interesting how I got involved in the project. As I mentioned, I have a health background through my major and being on the pre-med track, but a lot of my friends were in computer science and wanted to compete in this AI competition. And recently, I feel like there's been so much talk in the medical field about ways to implement AI to better care for patients. So I kind of recommended doing a project that would focus on improving health outcomes, and I would act as a health consultant for the team. And even though I don't have the greatest background in computer science or AI, nor can I really get into the logistics of how they were able to create the project, I do understand health disparities very well and the ways that which we can improve health. So dental health specifically, in many developing areas around the world, is considered a privilege. We often think of primary care as the biggest thing that we need to implement around the world when we think of health disparities among global populations. And because of this, dental health kind of gets ignored and neglected. And this is something that the World Health Organization has mentioned numerous times about how oral health is a neglected aspect of global health, despite the fact that these diseases can be easily prevented and treated with cost-effective measures. And also issues with oral health translate to greater health issues. So for many individuals around the world, the high cost of dental care and the belief that oral health isn't as important as other aspects of physical health acts as a barrier to care. And through my global health minor, I've had the privilege to travel to a lot of developing countries, and I've seen firsthand how this is a very prevalent issue among developing nations. So we came up with auras to address this problem and make it affordable for people to receive dental care. Our AI device is a mobile application. So we thought that this would be able to reach a large set of people, especially within the developing world. And our camera device was something that was very cost effective when we did the math for that. And we thought that this would be a very easy and cost effective way to address dental health.
That's a very interesting insight you bring in where the disparities come into play. I was kind of more expecting to hear about this is how our AI model works and whatnot, but you bringing in the idea of health disparities around the world is actually, it made it even more interesting because it just added another sort of dimension to our discussion today. It's very cool to see AI being at the forefront of making technology cost effective. Especially kind of using primitive technology, for lack of a better word, that most of the global south has access to. Most of the global south doesn't have access to the GPT-4s and the DeepSeeks and whatever else is coming out with the first world in mind. And the rate of innovation at which the global north gets ahead in the world is the same rate at which the global south falls behind. And it is actually very refreshing to see a project kind of dedicated towards the disparity itself, and specifically dental health, which like you mentioned before you did, it was kind of hard to even for me to fathom that it was actually a privilege. It really is. And even in the modern day, when we do our health insurances, dental health is a separate thing. So you can get primary care and everything else, even vision. However, dental health is just not included in the whole thing. So it is definitely considered a privilege in the Western world, and I can only imagine how it is in the global South. Very, very cool insight. So I wanted to kind of ask Katherine as well, like Rida mentioned about the role of technology in specifically dental health and closing health disparities. What are some ways do you think global epidemics, including the nicotine addiction epidemic that we face today in Gen Z, how can technology play a positive role, especially AI? Do you think can play a positive role in helping us mitigate the issues of addiction, specifically in the case of youth and Gen Z that we face today?
The great question. I think honestly, if used correctly, it can have tremendous positive impacts, helping people break free from addiction. One of the most interesting and inspiring trends I've noticed on social media is how people are turning to AI for personal guidance on a range of different issues, from mental health to addiction recovery. And what's even more fascinating is the real measurable success that it has had. Which kind of takes me to my next point, which is that in 2023, Sam Altman said that, or made a prediction saying that he expects AI to be capable of superhuman persuasion well before it reaches superhuman general intelligence. So that raises the question that if AI can master persuasion at a superhuman level, then why couldn't we use it to rewire cravings at a subconscious level? And this is kind of an idea that has started to gain quite a bit of traction. And an example is actually this AI-driven app called Tracy, which is designed to help people kind of retrain their brains and break the cycle of nicotine addiction. And its founder is actually someone who tried everything for years to quit vaping, but discovered that by prompting ChatGPT to perform certain conversational hypnosis prompts, the same as ones that are being used by licensed therapists, he was actually finally able to quit. So I think it's, kind of recognizing the power of prompting and how AI can replicate and democratize access to behavioral therapy techniques such as CBT or motivational interviewing is really important.
AI for behavioral therapy has got to be one of the coolest insights I've heard so far. Just in general in the global health space, I personally don't have the most experience. So this is actually one of the conversation circles I was looking forward to the most, coming from very much not a health background at all. This is very, very cool to me. And yeah, like again, I would have kind of expected more of a how hardware technology, specifically certain types of vapes with levels of nicotine, kind of lowering it down. That's something I've heard, technology kind of playing a role in lowering or mitigating the addiction process kind of slowly for people. But using AI for sort of therapeutic reasons and behavioral therapy and being able to talk is actually incredible. And it's great that you kind of bring that up. And on the topic of global disparities in health education, as well as sort of just the global health space in general, I think the disparity has a lot to do with the climate crisis that we face today. And Oyin, if you have any insight on it, I would actually love to know kind of how the climate crisis in the modern day plays a role in the growing disparities in global health, as well as sort of health services that the global south receives, and how it's being impacted by the changing climate.
Yeah, of course. So, as we all know, the people who are the countries who are contributing the most to climate change are, I mean, the countries who contribute the least to climate change are unfortunately getting the worst impact of climate change. So it's just quite sad that this is the reality of things. And we've seen trends have already shown that people who are not able to help themselves in terms of like getting resources to mitigate the impact of climate change and reduce like the progression are the ones who are not able to also advocate for themselves on, global stages. So this has definitely caused a bias and has broadened the bridge between healthcare and actually, people being able to seek for care, to advocate for themselves and all of that. And this is just really sad. Talking about the, how AI intersects into this issue. I'm going to speak about environmental health and AI. So one of the things I worked on during the summer was actually on my applied practice experience, and I had the opportunity to work with a team in Lagos, Nigeria, where we were studying the impact of indoor air pollution on non-communicable diseases such as hypertension and diabetes. And based on prior research, we actually saw that there is a connection between both. So people who are exposed to indoor air pollution from unclean cooking methods, especially in global south countries, are at risk of coming down with non-communicable diseases, hypertension especially. So the implementation science research that we worked on was actually to use to know about the impact of using AI-powered sensors known as purple ears and eye buttons in monitoring people's usage of improved cooking stoves if they were provided these things for free. So the organization I worked with got a grant, and they were able to use this grant to purchase purple airs and eye button sensors. They're very tiny instruments, and also purchase improved cooking stove methods and gave them to some users in peri-urban communities in Lagos. And then we, of course, educated them on the benefits of making the switch and told them about the health benefits for people who were diagnosed with hypertension at the baseline. They were recommended, taken to primary health facilities to get treatment and all of that. And we, of course, began to use the purple air sensors to get real-time data on how they were using these improved cook stoves method. And then later we went on to check their blood pressures and all of that. We're still at the end line of the study, but the preliminary results, sorry about that, actually showed us that people who have made the switch, who have adopted cleaner cooking methods, have lower blood pressures. So it's very important because, I mean, this study is very important because not only can we monitor their usage in real time, we're also able to give, like, to make policy recommendations even to the local government there, because we can see the results on time, we can see it happening right before our eyes, and people can also see the impact and the effects on their health immediately. So this is really important. I think that the study is something that would definitely also get to the federal government in terms of policy, and once they see the results, they would definitely want to take on our recommendations for healthcare.
I really hope they do. And that sounds amazing, and kind of tying in like you previously started with your passion for disparities in women's health and leading you to the climate space and the global health space in general. And today you're pursuing a degree in the city. Yeah, the journey is very inspiring, and I loved to hear kind of like an international perspective on a project of this scale. Similar to Rida as well, I would love to know a little bit in. We'll let some questions flow in first. About, you mentioned because of your global health minor, you had some international experiences where you were able to travel and see firsthand how people of the global south and a lot of us, or essentially the rest of us, face some of the global health challenges that we take for granted in the West. Um, Right now, we are at the halfway point of our conversation circle, and it is my pleasure to open up the floor to the rest of the audience, where we will create an open dialogue scenario where feel free, the audience may feel free to sort of ask questions to each other, not only the speakers as well, and of course, feel free to ask the speakers questions you may have had based on sort of the discussions that you've heard so far. And speakers, feel free to kind of bounce ideas off of each other. Please feel free to redirect questions to one another as well, and the rest of the audience. I see we have a question, Aktas. Yeah.
Hello, am I audible?
Yeah, please feel free to introduce yourself and your question or insight that you have.
I'm Aktas, and I'm currently studying at United World College, UWC, USA. And I have a question to Katherine. First of all, I really loved your talk about AI and CBT, but as you might know, AI-driven therapy collects deeply personal data, and we've seen real-world like scenarios like when Siri and Alexa recorded and shared private conversation without user consent. And given these risks, how can we guarantee that AI therapy platforms protect patient confidentiality? And what safeguards exist to prevent misuse by insurance companies, employers, or law enforcement? And how do we build trust with vulnerable individuals who might avoid seeking help due to these concerns? Thank you.
Thank you for your question. I totally agree that AI-based therapy can have its negative implications. While I'm not entirely sure on the specifics of how, to your question, but to kind of just go off that, it kind of on the contrast of what I said earlier, it can be super damaging to use AI as therapy if done wrong. And I think one of the, I think we've all seen horror stories of how AI has been used to has unintentionally given the wrong advice to people who are suffering from significant mental health issues and are, kind of need that controlled environment and a certain level of emotional intelligence in their therapy sessions. So, completely relying on AI for that can definitely be damaging, and can have adverse effects. And I think we should, again, be very educated on these things and, kind of establish better prompting and techniques on how to use this efficiently.
Absolutely, Catherine. I agree as well. And I think I want to add a little bit to yours, your insight on the question itself, because it does bring in a very sort of crucial point here, like you've agreed as well. It is the AI models that we are relaying at the end of the day that we don't know how unbiased they are. In fact, we know they are biased. For example, one quick thing that kind of comes to my mind is there was like a big social media sort of uproar regarding this specific issue as well. Or you might be able to kind of chime in on this when you I don't know, they might have fixed it with a patch or whatever, but the AI model were biased towards beauty, and beauty being something very subjective. When you ask about like a gorgeous woman specifically, it would always be like a European or a white or a fair-skinned blonde person. And this has happened even personally, not to say that my personal AI model or ChatGPT that I was using was entirely sort of representative of all that there is, but I was clearly not the only one kind of facing it. So yeah, so there was clearly an issue bias, and certain prompts would prompt the model to push for a certain racially biased picture or an image or a graphic that the AI would generate. So if you have any insight on it, I would love to know. There's been talks in terms of the growing disparity, the gender disparity that kind of comes into play when we're having this discussion as well. Okay, let me know if you are having technical difficulties. You're off camera now, but I'll move on to Brooke's question, and I would love to come back to it. Brooke, feel free to introduce yourself, and the floor is yours.
Thank you. Yeah, this is great talk so far. Really appreciate the information given. My question goes more to Catherine. So it kind of relates to the question that's in the chat right now about, how, the kind of like the struggles and challenges of like when it applies to, more of the global South. And that's kind of my question would be, um, yeah, I understand like how, addiction is like, it definitely has both like a physical, biological aspect to it, but also a mental aspect of it up to it being that someone has to figure out what the deeper problem is. And I definitely see the value in having behavioral AI help out with that. But I was wondering, like, what would in your perspective, like some of the challenges be when trying to apply this to the broader community, that also being the global South? So, people in poor rural communities. I mean, someone listed down on the chat, internet and struggle to use technology, lack of access. Like maybe that's one way. I was thinking maybe in terms of more like a societal way of like terms of, I don't know, like a sociological way in terms of what might be pushing, also in the bias part. I was just like trying to gauge, your personal view on the challenges basically of having this behavioral AI model for addiction for the broader community, that also including the global South.
I honestly think that, AI has the potential to offer, to kind of go back to your point, to offer help and support that people dealing with addiction or other issues need, but don't, in poor countries specifically, who don't necessarily have the means and access to seek actual, in-person therapy. So honestly, I kind of look at this in a more optimistic view that AI actually can, fill the gap for that and help people who don't usually and have access to these resources finally get that through AI.
Yeah, and to add to Catherine's point, I think the it is not the fault, just in my opinion, of the AI sort of the service itself, the service of behavioral therapy and behavioral therapy service itself is not the issue. The models can definitely be refined in the technical terms and improve upon sort of more data as data gets added to it and everything. However, I think the accessibility question still remains. And a way to kind of go about, if we remember from one of our previous conversation circles, we spoke about building more infrastructure and investing in the technology infrastructure in the global south, that which is actually very cool to see how investing in technology infrastructure in the global south helps the global health space in the global south, like issues such as that, Catherine, you're trying to tackle from a youth perspective. I think um, investments in technology being able to help global health is a very cool insight. So that is something to take into account as well. Could be one way to tackle the idea of accessibility that we face in the global south today. Another one I think I remember was the AI models being lightweight. So, and being able to be run locally, and mitigation strategies of that sort, that could definitely help bring these innovative sort of approaches down to the people that have never experienced it before, instead of always kind of focusing on the first world or the West.
Yeah, that's really interesting. But I totally agree with you. Like accessibility is always going to be a problem when you're talking about when you're trying to go global, like wide scale. I also thought it'd be like somewhat of an interesting conversation to consider like the when you're talking within a behavioral AI model, what kind of philosophy, what kind of societal structure that it might impose on one person, saying that, oh, someone who doesn't have, I mean, at the end of the day, this AI model is to help people, from my understanding, like to help people get off of addiction. So it might push a certain agenda saying, I don't know, depending on whatever country was trained on, that, oh, an AI model, sorry, a person without addiction usually would be someone who goes and does chest every day, at the gym. I don't know. That's just like a very funny, silly way of putting it. But, there's like simple societal structures that are somewhat put into these AI models. And when you're applying it to like a global scale, people come from different societies, different backgrounds, different structures of like growing up, different, even on like a smaller scale, like they have different relationships, with their families and whatnot. And yeah, this societal perspective, I think that's like an interesting thing maybe to dive in. I don't know if you guys have any perspectives or ideas on top of that. Maybe I think that would be really cool to think about, talk about.
It is a very cool point that you bring up. The idea of kind of individualizing the the AI experience is specifically when it comes to behavioral therapy. Because at the end of the day, we are human beings, and generalizing us is I wouldn't even say bad or good. It's difficult. It's extremely difficult. We are sort of uniqueness is our significance, I think, as human beings, and which makes us difficult to understand because no two human beings think the same or are the same in many different aspects. So it is, I guess, remains an interest to explore how AI can go about understanding humans. But currently we are humans are trying to understand AI and go about exploring and developing it. But yeah, would be a very, very interesting way to kind of switch it onto the other side. Um, but I just see Oink had a technical difficulty, but no worries. I'm glad you're back. Brooke, thank you so much for bringing that up. Actually, very very cool insight in my opinion. Eileen, you had a question in your hand raised. Sorry, but getting back to you now. The floor is yours. If you're still there.
Hello, can you all hear me?
Yep, you're audible.
Great. Thank you. This is very informative session, and thank you. I'm actually at the UN Women CSW, so I'm going to ask some question that's related to women's health, and which was raised as a matter of fact yesterday. And one of the ladies at the session talked about aging, and that's one of the topics that has not been on the focus for years. And one of the areas she was talking about was like menopause for women. And as a result of menopause, as many of you might already know, can increase the risk of cardiovascular diseases, dementia, and other kind of diseases. So the short question is, what does AI, or how can AI act in this aspect when it comes to whether it's the prevention or delaying of the menopause, as well as the prevention of not the menopause itself, but the result of the increase of, say, dementia? Thank you.
Oh, do you have? Yeah, I was waiting for your mic to go off.
I'm gonna raise my hand and say something about that. So that's a great question. I wouldn't say I have 100% of the answers, to be honest, but I'll just give you based on my experience and knowledge. So every woman has to experience menopause, right? It's a physiological thing. There's nothing like pathological about it. So in terms of like delaying menopause, I wouldn't say that that's something, we would want to interfere with, because every woman has to experience it. It's part of growth, and even there are some women who look forward to it because of like the issues that come with like seeing your period every month and all of that. But in terms of like delaying the onset of like menopause related illnesses or disease conditions, I would say that I hope we actually get to a point where AI can detect when people are at risk of these things and like easily point it out, because not every woman is going to have dementia, not every woman is going to have a CBD that's related to menopause. So I know that there are currently advances in medicine that are able to detect early when women are at risk of such diseases. It's also easy to know from a person's lifestyle. And I usually tell people that hypertension doesn't just creep on you. Like you have to have been living in a certain way, maybe through your diet, through your lifestyle, and all of that. So, and obviously, like a person's weight is also an indicator. So it's I think how AI can help is by pointing this out much earlier. Obviously, people also have to go to the healthcare system to seek for help and do their regular checks. But in terms of delaying menopause, I don't think, personally speaking, I just think that it's okay to leave it as is. When a woman experiences menopause, it's normal for it to come. So I don't know if this answers your question.
Incredible that you bring up the idea of kind of AI detecting the effects of menopause and not necessarily delaying, not necessarily the delay of it, because at the end of the day, the worry are the negative effects that follow through. And you've already mentioned a handful of factors that contribute to the certain different distinct effects that come about as a result of menopause. And the way these generative AI models kind of work is by taking these certain factors into account with certain weights to them and analyzing these factors, running it through the models themselves, and then giving out an output. So kind of going back to the idea of AI being able to detect when the certain effects are going to come about. I think this is very it's safe to say it's not impossible at all to create a solution of that sort, and of course taking accessibility into account, making sure women who deserve it receive it, is specifically in the global south, as well as the Western world, where women all over the world kind of go through a very natural process. But being able to delay the effects of it and being able to, essentially mitigate the effects of it, and detect when they're going to come, is only going to help you take preventative measures ahead of time. So it only helps. And that's a very, very cool insight. I'm actually very much enjoying, I don't know if it's just me, but the sheer amount of dimensions that we've added to this conversation. We went from climate and environmental health to youth advocacy in global health, as well as the disparity between the global and south and north, and now on the topic of women's health. Super, super cool. Vaishnavi, you had something in your mind. All yours.
Yeah, first of all, this has been such a great session. I'm gonna go ahead and I would like to talk about something earlier in our conversation. We were talking about the regulatory frameworks around the adoption of AI in the healthcare space. So, like with the FDA regulations, or when we're allowing these doctors or these hospitals to actually like prescribe AI assistance, in their current practices, what are some existing barriers that exist for introducing AI, whether it's with their data or actually allowing AI to, or these emerging technologies to be used, and how can we kind of mitigate that? This is a question to like any of the speakers.
I can start and answer a bit of that question because this was a big issue with doing our project. Obviously, we're collecting images of people's mouths to do our to be able to detect early signs of gingivitis, endovitis, things like that. And it was a huge concern on, how do we ensure that patients feel comfortable with giving up this information, and how do we not keep all this information? So the whole issue of confidentiality is so big. And when we were looking into, what regulations are in place, how can we deal with this issue, there really isn't a precedence that's been set that allows for regulation when it comes to healthcare and AI. And I think that this is something that lawmakers need to consider. This has been a big issue where there really isn't that much regulation with AI right now. And unfortunately, we kind of just have to wait and see what policymakers do. And in the meantime, when thinking about confidentiality issues, the thing that we implemented in our app was just the terms and agreements to, be very transparent with the fact that we aren't collecting this data to sell to other companies or do anything of that, and that all of our data would be internal and not used for anything else. But yeah, I think this is just something that needs to be discussed a lot more when it comes to the future of healthcare and AI.
Brooke, your mic went off.
Yeah, I
Leave it.
just want to say that Vishruth is here as well. One of the other panelists. But yeah, it'd be nice to hear from him as well.
Yeah. Hello everyone. Apologize, I was running late due to exams. So yeah, but I'm glad that I'm able to participate and make it today. So yeah, just a little bit about me. I'll be an incoming student at Duke University School of Medicine in the Master of Management in Clinical Informatics program. So I have a strong background in sort of this topic, the intersection of AI with health and advancing SDG number 3. My particular area of interest is sort of like ethics as well, and how we can best deliver AI in an ethical way, in an equitable way, so that it benefits the most patients, as many patients as possible. So yeah, happy to answer any questions. Thank you.
Vishruth, I'm glad you were able to at least make it to it. I really hope to see you at a future conversation circle as well. Sorry to hear about your academic commitments, but Yeah, glad we're all students and go through exams, but glad to have you here. On the topic of ethics that you mentioned, it's actually great timing. We just brought up the topic of sort of ethically serving health services or providing health services, and an issue that often comes up is data privacy, that we've spoken about time and time again at our previous conversation circles as well. I know HIPAA is a big player in the field, specifically with medical data. However, when we have large language models and these gigantic big data and AI models taking over, not necessarily taking over, but playing a bigger role than ever in the healthcare or the global health space, what do you think are some of the ethical concerns that arise, and should um, how should we go about it, or how some things could go right in this complex sort of big data driven world that we're running towards?
Yeah, sure. Thanks for that. A great question. Um, uh, so actually, I'll send a link to uh, some research that I've been doing, but in the chat. Um, I think one concern is well, actually a couple of concerns. So one is regarding data collection. So AI actually needs vast amounts of data to be able to analyze, and then, that's the nature of AI, right? So it'll analyze some data and then kind of use that as a template to perform further work, or improve itself. So in machine learning applications, for example. So the challenge is we need to feed it enough data, and uh, and with that, where do we get that data from? Uh, is there any consent, or um, uh, other concerns that are involved? So those are some questions. The good thing though is that, for example, in the field of genomics, we have, in the Human Genome Project, we have so much vast amounts of data um, on gene expression, or SNPs, like single nucleotide polymorphisms. So in the field of genomics, there's a lot of data that's growing, which is good, and it offers a lot of potential for, like, for example, diagnostic medical AI to be looking at like genome profiles of patients. So so data collection is one point. Another point is patentability, so intellectual property concerns. So for example, uh, AI, like when inventions are being coming out, related, involving AI, and new products, how do we ensure that they can reach the maximum number of customers and providers as possible? It's important that these products are patents can really um, expedite the process, and facilitate these products reach to more healthcare providers and patients. So um, you know kind of going into like a little bit of detailed concern is differentiating their diagnosis methods. With so many products coming out nowadays, so many developers, how do people differentiate these things from other diagnostic methods? um, how do they market themselves as unique, and distinguish themselves? So these intellectual property concerns are also something we can talk about. So yeah, those are a couple of concerns, in the deployment of these AI products.
And out of both, the most interesting one was the first one that you mentioned, where the data privacy and the privacy side of things with HIPAA and everything. Yes, the patients are protected with their data from getting out and whatnot. However, these on the contrary, these AI models, in order to get better and provide more accurate, better individualized services, need to be fed the data. But if you're protecting it and keeping it private, then you can't do just that. Um, yeah, very, in my opinion, extremely cool and interesting ethical dilemma here. And we await to see how policy, in my opinion, shapes um this ethical dilemma and where it goes, and where we draw certain lines and where we start to blur them. But yeah, very, very interesting that you bring this up, Vishwa. Thank you so much for your insights. I wanted to say I would love to continue with it, and even in the last 4 minutes of the discussion, we added another dimension to the conversation, bringing in the idea of ethics and data privacy in global health. So it could have only gotten better as we went, but we are at the end of our conversation, with it being 8 p.m. in the Eastern time zone. Thank you so much. Just wanted to let the speaker panelists, Katherine, Rida, Oink, and Vishrut, know that it's been a pleasure having you guys, and the sheer amount of sort of angles that we've looked at global health from has been very enlightening, especially for someone that has no background in the health space, and pretty much kind of comes from tech and policy. But I'm sure I'm not the only one in the room here that felt that way. And just extending our utmost gratitude to the speakers for being here, and your time, as well as not to forget all the attendees in the room today, without whom we would have not been able to pull it off. Thank you for a full room and this incredible discussion. I look forward to following up with all of you in the panel, and hope to include everything that we've talked about in our white paper coming up later this year. It would be a pleasure. Thank you so much.